Hey guys, it's Dr. Emeka here. Now I want to tell you a little bit about cheyne-stokes breathing. Now this is an alternate breathing pattern often characterized by deep, rapid breathing followed by shallow breathing and then a period of no breathing at all, apnea, and often seen commonly in the last days of life. So in the care home or the hospice, it can be seen in certain medical conditions, but this is when we often see it. And normally the patient is unconscious and so not in distress. And families, if you're hearing this term said by medical professionals, don't be worried. This is just a natural bodily function towards the end. And that's just how we characterize it as medics, cheyne-stokes breathing. So if you hear this term, don't be too alarmed. It may look a little bit distressing, but I promise you it's not. Hey guys, it's Dr. Emeka here. Now, I'm going to tell you a little bit about what we mean in medicine by terminal agitation. Now, this is just a state of terminal restlessness, which is basically at the end of life, you can become restless, anxious, a little bit confused towards the hours and days leading up to your passing, or the patient's passing, shall I say. And these could be expressed in signs and symptoms such as restlessness, twitching, agitation, fidgeting, anxiety, feeling worried, shouting out, confusion. And there are a number of different reasons for this, a lot of them physiological, which means the body's natural processes, depletion in oxygen levels and pain could lead to this, but normally these are managed quite well in hospice and end-of-life care where support and comfort is given to the patient and the patient's family. So if you hear the term terminal agitation, end-of-life delirium, terminal restlessness, at least now you know a little bit about what it means. Hey guys, it's Dr. Emeka here, and I'm here to explain to you what we mean when we say DNACPR. Basically, it means do not attempt cardiopulmonary resuscitation. So in the event that a patient's breathing or heart was to stop, we would respect their wishes by not attempting cardiopulmonary resuscitation, also known as CPR. This can be a DNAR, do not attempt resuscitation, or a DNR, do not resuscitate. And usually this decision is made between the clinicians, the patients, and the patient's loved ones before any event was to happen. Sometimes in the UK, this can be expressed as a respect form, where there's a decision of escalation of what would happen if the patient was to deteriorate. So hopefully this clarifies it if you hear it in the care home or in the hospital, or if you're just curious.